Give myself away so you can use me. I give myself away.
Most towns and villages in Ghana have seen establishment of good roads, healthcare and security facilities as development. However, some communities can't lay a hand on one, and AJUMAKO Kromaim is not an exception of such. This is the road that leads to AJUMAKO Kromaim, a poor farming community in the central region with an estimated population of 3,500 residents. Aside their bad roads, healthcare facility has nothing good to write home. A 2-bedroom apartment turned into the community's clinic is the only healthcare center to think of. Currently, health practitioners are prone to evacuating the building. This facility was given willingly by a member of the town, now on pension, on the basis of getting it back after his retirement.
From AJUMAKO the 12th, AJUMAKO Kromaim of Finfimanto. I'm AJUMAKO the 12th, the main chief of AJUMAKO Kromaim in the central region. We have some challenges here in my community and we want to share for all to come to our aid. Prevalent now is about our healthcare. We have a place that has been turned to a clinic, but the place is someone's house and he donated it to the community to use in the interim, but will need it back when he retires from active service and comes home. Currently, he is on retirement and we believe he would be back home soon. Even the location is another challenge because it's a bit at the outskirts of town. Moreover, our roads are not in a good shape and the owners of the taxis that run here don't allow their drivers to keep the vehicles with them. So they have to go and park them at the nearby towns before coming home. So in case of any health emergency at night, there is no vehicle to transport the victims to the following towns to attend clinic. I for once had such an experience when I felt ill on one Sunday evening and managed to get to the clinic, but because the area was isolated, there was no one there around the time to administer drugs for me. So I had to look for vehicle to take me to the nearest town to attend clinic. We have land designated for this purpose and we need your help to put it to fruition so that we can also enjoy some quality healthcare.
To talk of the bad shape of the building and its poor environment, the distance between the town and the clinic is also a worry.
My
name is Nana Ejan III, the Ankobia chief of AJUMAKO Kromaim. We do not have a clinic and are appealing to corporate bodies, organizations, and other individuals to come to our aid in getting a befitting health post for the community. For instance, a younger sister of mine was due for labor. It was around 8 p.m., but due to the bad nature of the roads, no taxi driver was willing to risk it. It was out of the blue that a taxi came to drop an indigent at midnight, where I pleaded with the driver to convey my sister to the Esikuma Catholic Hospital, which he obliged. We left the village around midnight to Esikuma, which is about an hour and 30 minutes drive from Kromaim, just for her to deliver her baby. Meanwhile, we have a midwife here, but don't have the place and accoutrements for her to function properly. Another amongst many of our challenges is when a child was bitten by a snake in the evening, and we couldn't convey the victim to the main town clinic on time, which also caused the death of the child. So if we have a place here that can assist nurses to have better health care for us, we would be very much appreciative.
Speaking with the health practitioners of the clinic, they expressed some of their worries.
I'm Emayamwa, a community health nurse and part of the staff nurses in Kromaim Chips compound. Of late, we are having a big challenge with our facility where it is located. And then due to that, it is difficult for clients to walk all the way from town to where the facility is, and then that is a big problem to us. And then where the facility is located to is another issue. It's a partial something that's someone donated to us for a short period of time, and then the time is up now and the person is back home. The person wants the facility back. So we need help to get a new place so that we can continue giving services to the people in Kromaim. We are in need of hemoglobin test kits. It's now in the system. Some is a new mode and an acute machine that can help us take the blood sample of especially our pregnant women, so that we know their HB level. Instead of them traveling to the next 2 towns to go for laboratory tests, it will help, because at times they even complain of not getting money. So they have to go back home and stay back home.
Okay, I'm Ernestina Odrankuma, the IC of Kromaim Community Clinic. I'm here to tell you about some of the challenges we have here. Right now, the small girl came here for service, and because our thermometer is spoiled, we're not able to check her temperature for her properly. So we touched the forehead to see whether she's warm, and she was warm to touch. So because of that, I took this suppository for her right now, and she's a little bit okay now. Our BP apparatus is not also working well, but because of that, we are not able to check some of our clients' BP for them. Right now, we have problem with our weighing scale. So when somebody comes here, we find it difficult to check the person weight for him or her. We want your help in a small notice board so that we can paste our flip charts and posters on it.
We are also pleading on you. We want refrigerator. Is also the next crucial thing in our list, because the refrigerator is where we keep our vaccines. We store them for outreach programs, and then we don't have it in our facility. We have to send it to the next 2 towns. We have a clinic over there. We have to send it there for them to store for us for our outreach program. So when the times come for outreach program, we have to board a car from here to the next 2 towns. Even at times, going there is not easy at all. But we have to, because we have to give services to our patients. So please, we are pleading on you if you can help us get the refrigerator so that we can store vaccines in our own facility. That's on our outreach programs. We can just pick them out and then go straight away instead of waiting and then keeping our patients.
Another challenge is we need a glycometer too. Some of the diabetic patients, when they come here, we don't know their sugar level. So if you help us to get the glycometer, we'll be happy with it, so that we can check our clients' sugar level for them, because they will not know whether it's high or low. So please, if you help us to get the glycometer, we'll be happy with it. And we need a relocation too. If you help us to relocate from here to other place, a big place, to get a maternity ward, to get a female ward, male ward, consulting room, a place where we can store our drugs well, and family planning units, and so on more. And we need to provide privacy for our clients too. For instance, when you come here, we have our 2 beds here to detain our clients, and this place is also OPD area, so we can provide privacy for our clients. So please, if you can come to our aid to help us to get a new place bigger than this, we'll be happy with it. Thank you.
The people of AJUMAKO Kromaim seek for help to make their life a better one.